Hi, Sailaja Garu, Dr. Sailaja, and thank you so much for making time to be coming all the way to be a part of this podcast, which I run, which is called the Scrub Guru, right? So we try to bring interesting people and experiences of life so that each one of us grow to be a better human being at the end of the day. I think it's uh, a huge purpose driven entity that we are looking at. I am aware about what you're going through from a health perspective, being a doctor yourself. It makes it more interesting, and I can't thank you enough for doing this because I know how difficult a lot of us, difficulties that a lot of us face while we ourselves are faced with challenges in life. And if it's physical, then it's even more. So, huge amount of respect and thank you for doing this for everybody who's going to listen to us and stuff like that. Let's begin with just a background about yourself. uh, what sort of a doctor you are, what kind of medicine do you practice, and so on and so forth, and where were you born, something about your childhood and stuff like that.
Thank you actually for having me, Dr. Watts. I mean, I was like, um, I actually was like, I never thought that, to accept myself, to be like this and to be presentable to the world was such a huge leap for me because it wasn't easy. And I thought when you called me and you asked me to do this, I thought it was so important for me to know that acceptance is what is the most important thing in life. Just surrender to the fact that whatever comes and throws at you, there is nothing you can do about it. So, thank you so much uh, for having me again. And for me, this whole journey of what I'm going through at this point of time has completely changed my whole perspective of life. I mean, it's a new life. When people say it's a new life, they all said. I initially used to think, yeah, they just say it, but yeah, I think it is. So coming to, yeah, I did my fellowship in fetal medicine. I did my master's in obstetrics and gynec. I loved being a surgeon. And I don't know how I chose. My mother-in-law insisted that, before you come and jump and start doing obstetrics, that you'll anyways do, why don't you do fetal medicine? So at that point of time, 15 years back, fetal medicine wasn't so popular. Yeah, it was picking up. There were people who were doing it, but not like how it was today. So I was not at all interested. But I thought, fine, okay, let me go learn. And then I did learn for 6 months in Chennai fetal medicine. But somehow it didn't excite me because my heart was always in surgeries and delivering babies and seeing, because I always felt doing fetal medicine. Somehow I didn't have that with the patient. I didn't feel like doctor. I mean, like there was not much interaction. But then I thought, I finished my 6 months and I was like, oh, I finished the 6 months. I know how to do the basic scans. Let me go learn. So I went to Anantapur. There's a place in Anantapur called Battilpalli. Not many people know, but there's a rural development and trust hospital started by a Spanish man, and they do about 1,000 deliveries, everything at a very nominal price. And so I wanted to go learn there because there are like 15 sections every day and so many hysterectomies. So I went there, and because they also had an ultrasound machine. Not many people knew how to do ultrasound. Luckily, the 6 months that I did, I was like the superhero there. So I started doing, and when I was doing, because there was no interest, I never liked it so much when I was learning. But here, somehow I started liking it because I started, I was able to see things and observe what I've learned, and the numbers were huge. And then there were a lot of Spanish people and people from a lot of European countries would come and teach the doctors and the DNB students over there. So they were very amazed at the way I was scanning, and they were like, "You're so good at it. Maybe you should do it." I was like, maybe I'm good at it. I started liking. So then I called up again Chennai. I said, no, now I want to come for an advanced. So I ended up, and then I went to learn now with real interest. Initially, I just went because I was asked to do it, and then I think I've done my advanced fetal medicine, and I did a fellowship in fetal medicine in Chennai in fetal medicine center, and I came back and I joined Cloud9. I worked in Cloud9 for 10 years
Cloud9 in Bangalore.
in Bangalore in Old Airport Road.
Right.
And I've been very fortunate to work with some really great doctors and a great team of people. I think we were doing the maximum number of deliveries in South India in our center. And I was doing the maximum number of scans in Bangalore at that point of time because we were delivering about 250. I was doing about 700, 800 scans per a month in a month. So that was about 40 scans. So I was like full. I was like so happy doing so much fetal medicine, and it was such a great opportunity to be working with such great people there and such a great team. So yeah, so that was my journey of fetal medicine, and basically born and brought up in Vishakhapatnam. I'm from Andhra, and then I did my MBBS from Hyderabad in Kamneni, and then got married and to Bangalore, and then I did my MS OBG in Devarajas in Kolar, and that's my journey.
Very nice. So interesting. So how sometimes we discover passion, right? That's precisely what you were saying. And
Something which I never liked.
exactly, right? So a lot of us, it's always a journey. Like I tried talking to younger doctors, younger dentists, especially. Even recently, I was in a dental school in Mysore trying to speak with young dentists. Most of us, especially in dentistry, feel or do dentistry because we did not get medicine, you know, and the entire journey of our career goes with this single thought that I didn't get medicine, so I'm doing dentistry, But I think that's such a uh, injustice to our own lives, plus the lives of patients whom we treat, because ultimately that is an element of truth that only you know as a person on how much of passion you carry for what you're doing. In this field of medicine, I feel it is extremely essential for all of us to be not just dedicated but also passionate about what we are doing, because it's about counting lives of people, it's about improving quality of lives of people, and so on and so forth. So imagine if somebody is not motivated enough to continue their profession and it was their option B. It's a very sad thing, but none of us realize this, like you said so truly, that life happens. Sometimes shit happens, and that's about life. You can do nothing about it. You very well said that you can do nothing about it. So given the fact that I also wish, and maybe so many people wish, that I was born to the Ambani family,
Yeah,
and
so do I.
right. So when you look at things like that,
Yeah.
it's a never-ending story.
Yes. Maybe you should do a podcast with Anand, then you'll know if you really want to be born.
Yeah. So at least of the few people whom I know who are probably wealthier, richer, and stuff like that, they are also the same poor people who are going through the same thing that most or everybody else goes through. Maybe their problems are even more complex just because they have more money and visibility and fame and, you know,
So one thing is for sure that I've learned, which I didn't know for a long time. Problems are constant in everybody's life. It's just that the problems are different.
different. Actually, what you said is very true. In fact, in our Vedic literature, this is precisely mentioned that we are living in a world which is called Dukkhalayam Ashashvatam, which means that there is suffering and misery in this current existence that we are in.
Okay.
There is no way,
You can escape it.
yeah, you can escape it. Like there is a way to escape it by our scriptures. They do recommend how we should live our lives currently so that at least we don't come back to live this misery again. So there is a philosophical truth in that. But now that we are here, how do we ensure that we understand this, make peace with it, and do the right things to continue this journey what we are doing so that we at least don't mentally suffer, because it also says that uh, Bhagavad Gita talks about this, that uh, every person who is born, so birth, disease, death, old age, this is a part of life.
You can't
Nobody
change.
on this, yeah,
Anybody
nobody.
tried changing it only
No.
from our even historic scriptures? We
Exactly.
know it is.
Absolutely. So there is
It's
no way.
impossible.
Yeah, exactly. So there is no way this is going to change. Now, the deal that we have to make is how do we make this life with this knowledge and awareness that birth, old age, disease, and death is going to come. Everybody who is living currently is going to go through this. You're born means the rest three are going to happen. And so we have to start living a life of more meaning. We have to start living a life which is probably directed towards exiting this whole, cycle of birth and death, is what Bhagavad Gita teaches us. I know that very recently you have been diagnosed with breast cancer. And incidentally, I read an article in India Today, I think, which spoke about the rising incidence of breast cancers. And it's saying that in India, we are growing at about 5.6%
That's
every year. One in every 12 or 70, I'm not able to recollect that number, is going to have breast cancer
very soon.
very soon. And by WHO, it says people living in some of these progressive, economically progressive nations are at higher risk for breast cancers. And it's one thing that uh, I don't know, is it genetics, is it lifestyle, what is it that uh, people have to be aware of on this aspect? So I'd like to kind of tread this discussion on your own life experience, on because I know you even before you were diagnosed,
Yes.
right? Because I've seen you. In fact, we discussed about how we can do things together, and from a medicine perspective, how to reach out and help people. So I'll let you speak on what happened and how did you actually think that you need to go for a check, or what really happened?
Well, I got diagnosed breast cancer in October. That was the breast cancer awareness month of the year, I believe. And I saw a small nodule, a very small nodule, about 7 months back, sometime in March last year. And I had a small history of trauma. And then I felt that nodule that I felt was slightly painful. I thought maybe I hit myself really hard. Maybe there's some trauma inside and it's causing pain. So I went much because, and then got a scan with my colleague. And then I also gave her a history of trauma and pain as well. So she must have thought in her head that since ma'am was giving me, I'm her senior, ma'am was giving me a history of pain and trauma, possibility that it could have been some necrosis. So she said, ma'am, don't worry, it looks like some traumatic necrosis. I said, okay. But I said, it is painful. She said, fine, no worries. And then I went back home. And then I happened to meet a friend of mine. She's a gynecologist too. So I told her, hey, I think I'm feeling this nodule. It is painful. I don't feel any lymph nodes myself. Can you just examine my axilla and just check with the lymph nodes? And she checked my lymph nodes and she says no. And then she just said, we're just, we're just these heavy people. We have just big breasts. Maybe it's just some fat nodules. You'll find it at me. So I was like, I got convinced because there are no lymph nodes. And now that the scan also said that it's just necrosis, I let go. And then I think after 2, 3 months, I used to still feel the nodule slightly little bigger, but it never bothered me. So I remember once just like this going up to one of my doctor's room. We were just having a chat and I was telling, ma'am, I feel there's a small lump here and can you just check? So she just checked and she says, Shailaja, this looks like fibroid. I also have it, don't worry. So, and then she also checked again for the lymph nodes and it looked normal. I said, okay. So now that repeatedly everybody are looking at it and they're saying it's normal, I was like, okay. I again called my friend and my colleague, and then I wanted to get a scan done. Unfortunately, 2, 3 times I called her after 3, 4 months, and maybe she was busy or I was busy. When she wanted to come, I was having a scan, so it just got missed. How funny. And then last year, sometime in the April, I had a master health checkup uh, at the place where I also work in the evenings in Indranagar, the Lotus Diagnostic Center. Uh, I took a couple of my friends. Hey, you all need master health checkup. Don't neglect. This is the best place. We should do this. And we all went like it was like a trip. Morning go, eat some breakfast, and then get back. Do all tests. I did everything. One of my friends' mum was 78 who came, and then we were also in the master health checkup. Had mammogram. And I think just a day before or 2, 3 days before that, I spoke to some friend and I said, oh, I'm doing for a master health checkup. I have to do this mammogram. This, mammogram is so painful. Why do you need a mammogram? Just do a breast scan. I was like, okay, I'm not doing mammogram. Anyways, so I told auntie, go finish your mammogram. I ensured they finished. I ensured all my friends, everyone met all the doctors because I thought, let me be there with them because I know there's a difference when, as a friend, you're sitting with the doctor. All done. I was supposed to get a breast scan with my colleague again there. So I told when I was there that day, she didn't come. So I missed, and my girls, I go there, and my girls were, ma'am, all your master health checkup was done. Your breast scan isn't done. So I was like, okay. And I missed that as well, even in my master health checkup. So I'm like, sometimes when it needs to be missed, no matter what you do, I mean, I would call myself negligent for it, but somehow this didn't happen. So then this during this Dashera time, I somehow felt like I wanted to go every day in the evening, see every day they change a different color, and the Devi gets dressed in a different. I wanted to go for an evening aarti. So I tried visiting different temples every single day, some of the other temple, or otherwise there was one temple close by near my house. I would visit there. On the last day, there were too many people. I don't know how. I felt so sick. I mean, on the last day, the 10th day, I had just 1 or 2 fever. I could not move. I could not do anything. All of it. I was like, okay. And surprisingly and very strange, fever I was getting treated, all of it, I started feeling a lot of pain on my breast. And I realized the lump now when I started feeling it became s- much more bigger than what it was, and it was very painful. I said, okay, it happened on a Sunday. I said, first thing I'm going to do on going on Monday is to get a scan done. I went, finished my 2 scans. I called. I said, I called my friend Shrishta. She said, I need to do the scan now. So she said, okay, come. I went, saw, and then I usually, so I think unless something hits you really hard, you do not I mean, at least I did not understand what it feels for another person. So I know every time I scan, I'm always concentrating at the screen. I know patients are always trying to read my feelings. This is what happens because they have nothing else to do. Now I'm very casual. Like everyone said, it's normal. In my wildest of my dreams, I did not think it could be cancer. So I'm looking at her and then her face. So now I can read her face. So I looked at her. I said, "What's happening?" She said, "Ma'am, did I not ask you to come back after 2 weeks? After the first scan." I said, "No." Then I said, "We missed couple of times." Then she says, "Ma'am, I'm so sorry. It looks malignant." I said, "Okay." I didn't know how to react. I was like, "Okay." Then she said, "No, let's just do the biopsy now. We will send the biopsy." I said, yes, I know we need to do biopsy. Just give me a little time to think about it. I came out, called a friend of mine. I didn't call mom, I didn't call a lot of people. Called a friend of mine and cried. You know what? I've not been going. I just had tears. That's it. And then I was crying and crying, and then my just cried. And then I went to another consultant in between, and then she came. She said, "What happened?" I said, "I didn't cry. I mean, when I meet my other doctors, I." So then I told her, like, I was telling her, you know what? I just did a scan, and she said it's malignant. Then she saw, and then she said, "Oh, Shailaja, this also." Obviously, she's just trying to be nice. So sometimes it can be like this. All of it. I was like, okay. Then I finished my call. I told myself, fine. Now, now you have breast cancer. It is malignant. What do you do? It stopped working for like some time. That's it. I finished my crying. I called up my friend. I said, who's a radiologist, who's my junior. I called Dr. Prem. I said, Prem, I just got a scan done and they say it's malignant. I want to come and see you in the evening. He said, okay. So I went to him. He saw me. He said, yes, it is malignant. So then he said, come, go to Sakra. My friend is over there. You need to get a biopsy done. I said, fine. I went to the hospital. I drove to Sakra, got a biopsy done, got back home. And I somehow made up my mind. I was not even sitting there and hoping that, biopsy will give me something because I know ultrasound can detect what it is. So, and then I got my report and then it started from there. I still didn't want to tell anybody at home, like I didn't tell my parents or anybody yet. And then I met uh, through him uh, uh, Dr. Anil, where I'm working in Lotus. He got to know, he was in London and he messaged me saying that we've not been talking for a year for some silly reason. I was still going to work there. And then he called me. He's like, call me now. I called him and he said, Challenger, don't worry. I said, no, sir. I mean, by then I was already cool about it. So then he said, no, you need to meet doctor here. He's the head of the department in Aster. We will do like this. We will do like that. And I knew just between Dashira and that Diwali, everybody are busy. And I said, fine. So I did my testing done, I got to know, and then again I took my samples, again I gave it in Kidwai. I wanted to be doubly sure of what I was doing. So I told myself from somewhere deep inside, I had the strength. I told myself I'll deal with it. And yeah, and then I met, fortunately, because me being a doctor, I mean, I cannot thank uh, enough the way my friends have come to help me in whatever way possible, and trying to get me appointments. For being a doctor also, some doctors are so difficult to get. And then like all my doctors, and Dr. Vidya, I was working with her, Dr. Vidya, this, she was like my godmother. She's like, no, I'm going to call Dr. Somchekur. It's so by the time I could reach, things got so easy for me, and everyone spoke so well to me. And I think very few people got to know. Now I told myself, I decoded, I told myself, now I've met people, I had a plan of action. I also thought, okay, fine. I also came and met you even before I could start my treatment, because I wanted to be sure. I went and met my dermatologist. I because it was easy for me. So yeah, I met you, and you said, whenever you need, don't worry, we're always there, you can come. So I think all this kind of gave me a lot of hope that I'm going to sail through this, not knowing what actually chemo does. As a PG, we used to have these gynec rounds where these old women with ovarian tumors would complain, just give them the drugs. Okay, our duty was so, I just realized after I got it, it was so mechanical sometimes when you're doing as an intern and as a PG. Just write the drugs, just see the blood test. Okay, you don't qualify for chemo today, tomorrow we will do. That's it. So, absolutely no empathy because you're so robotic. And they're all in some general ward, and they're coming and showing you so much hair. And then I still remember once we were in OPD, I think one of the lady who walks up to us and she said, I lost so much hair, can we restick this to hair? So we all just laughed, not laughed, but we all just didn't know what to tell her at that point of time. And yeah, then I was also thinking, I think sometimes um, God really, really, I wouldn't say teaches you lesson. I don't know how to put it across, but sometimes, yes, life really teaches you. And what you're really attached to, I think you should be completely detached to, which is very difficult because I haven't still not gotten out of my hair. So I think undoubtedly I can say I haven't met any women till now who had more beautiful hair than me. I had hair like that. Anybody from my childhood, I would go, they would be like, oh my god, this hair is unbelievable. And which is so true. I would always kiss my hair and I would always look at myself and be so proud. Like, no, I mean, not proud of any other achievement, just be proud of your hair. So I could never think of a life without a hair. Can you beat that? And now that I've realized, then now in this whole process, I know after my first chemo, now I met Dr. Somshekhar, and he's been extremely helpful to me. And thanks to Dr. Vidya Desai, like she said, she's my girl, talk to her. And things have become so easy for me. And then he said, why don't you do it, even the medical onco with our own team? And I happened to meet Dr. C.N. Patil, and he's extremely nice. I just liked the whole thing. And they spoke to me and they said, oh, obviously all the medical oncologists would say, oh, don't worry, it's okay, 6 months, you can work. So my first question was, can I work? And they said, yes, you can work. And I thought, okay. So I told myself, and I had some of my friends, and now slowly I started telling my close first circle, okay, this is what happening. Oh, they're like, you're being so strong. I cannot believe, Shailaja, you're so inspiring. So I said, yeah, yeah. And I was actually. I was like, okay, big deal, big deal. So I was like trying to talk to friends, trying to figure out I should get a wig now. How can I not walk without hair? As though, without hair, you cannot walk. That's my thought. It almost felt for me at a point that my hair is as important as breath. Only when I don't have it, I realize it's not so important. It's only important for your eyes. So, yeah. And then I've been doing it. I told myself I've accepted myself without hair. Okay. And I went, fixed myself, saw so many places, and got myself a wig. And then after my first cycle, I started losing hair. Okay, little by little. It was little on a day, and then little more, little more, little more. I still remember on the fifth or the sixth day when I lost, and it was like such a huge bunch of hair. I looked at my hair. I said, they always say, right, that universe has its own way of, maybe it's when it takes it, it always gives it. I said, if it was the same me, if I didn't have cancer, if I lost some 20 strands, I would have been calling three of my friends and trying to, I'm losing my hair, let's do, what are we doing? And today I'm seeing so much hair and I don't have tears. I'm so happy at the growth that I've been. This was a video that I recorded for myself. Yes. And at some point I thought maybe I would need uh, to go back to know what my journey looked like. So I told myself, and then I'm feeling so good about myself. I'm not so attached. After my first cycle, I almost lost most of it. Then I went to shave my head, and yeah, I looked myself. It wasn't easy. Yeah, I finished my first cycle of chemo during this whole process as well. And yeah, I went, got a chemo port done, and did a lot of things in the whole process for the treatment. And I was very happy. Okay. And uh, then after my first cycle of my chemo, after the third day, I took 3 days of rest. And I realized when people say, now I understand why chemo is so difficult, you cannot explain what fatigue feels like and what tiredness feels like. I've never experienced. I only remember going to work. I was a PG when I was working. I remember working and doing night duty, continuing my shift till the next day evening. Sometimes I had an SICU duty. I would go back at home at 8 when I was full term pregnant. And we used to have these camps and we used to still go back in the night and still do notes till 12:31. That all seemed still easy with my 7 months pregnancies, doing assisting 3 4 hysterectomies, having lunch at 3 o'clock, and then again run because you have a journal club and be there, and you have to still study. You're the second year PG because they'll still ask you. All that felt easy, but this tiredness was something which I could not explain. This tiredness is something that maybe you do a 20 kilometers run and you're tired. It is more, it is so draining. And then I realized on the first, after my first chemo, after about one night when I slept, I was just lying on the bed with my eyes closed, but not haven't slept for a second. So, and I'm not knowing because for the first time I'm not even understanding what is happening with my body. And then started nausea. I only know because I was also practicing obstetrics and gynecology. I mean, like as in my PG life, and for a very short period of time before I got into fetal medicine, like in the first trimester, people would say we have nausea, but I don't know what it feels like. Oh my God, I could not sleep because of nausea, and then I called doctors. They said, unfortunately, there's nothing we could do. Oh, I said, okay. And it continued. I remember calling you as well because I had slightly mouth sores and I just lost completely, uh, no taste, lost the taste, and I couldn't eat. And you're tired. There's no energy. I was like, okay, I just coped up with this for the first week. And you're also losing hair because now it also, that is another thing, which is another aspect. And along with that, um, then I realized 1 week is over. I'm okay. Now my mouth is getting better. I could still eat, but nothing tastes the same. But then I started having diarrhea because obviously the whole gut was washed away, watery stools, no vomitings. Some have managed. After my first cycle, trust me, I always wanted to go to Mahakal. And I said, okay. And then one of my friend called me, he says, Doc, come, let's do Mahakal. I was like, okay, let's do it. And I finished my first cycle. Just before my second cycle, I went to Jain, did Mahakal. Usually my cycles are about 21 days apart. A week before the chemo is not very difficult. So I went, I came back. And then after I came back, I started my yes, the symptoms. Then by second chemo, I've realized that you are having gonna have a set of physical problems. Now treat these physical problems. I was still working despite of all of these. I couldn't drive. I was feeling for the first time I had a driver in my life. Because I've realized that, while going, there's a lot of headache, there's a lot of dizziness, and you're constantly feeling nauseating. You constantly have diarrhea. So, there's a lot of tiredness. So I thought, no, I don't want to take the stress of driving. So I have a driver. I've been working, and my colleagues have been extremely nice to me, and they've been very gentle to me. And by the second cycle, I think I've understood that. These symptoms are there, and don't be bothered. I mean, treat these physical symptoms as physical symptoms. And one great thing that I have learned in this whole journey of what I'm going through right now is to not bring in my physical pain as a mental or an emotional plane. I treat them so separately, and that has given me a lot of peace. I don't know how I got it, but yes, I anytime at any given point, no matter what my physical pain is, it remains as my physical pain, and it does not affect mentally how I feel. Mentally, I'm always telling myself that this is a physical problem that you are having, and this needs this kind of treatment. This comes with this kind of pain. This will take some time for you to deal with it. Treat it like this.
Wow.
This is my mental part of me telling myself that this is how you need to deal your physical problem, and I've been doing it.
Actually, that's so true to anything in life,
Yes.
isn't it?
Yes, it is.
Even when we face difficult situations in life, because it's your mind that actually gets agitated, that kind of wavers, that kind of goes up and down. So if you can keep both of them separate, then you'll probably get the focus on how to deal with the actual problem more efficiently and effectively. I also loved what you said, which is about our own training in medical schools, right?
It's so
And
tough, right? It's like a
yeah,
boot camp.
exactly. And if you're saying that, because most people don't understand that doctors end up doing duties, and today we are having debates about 70 hour per week, 90 hour per week. I think if a doctor just comes out and talks about how many hours we put in every day, 36 hours continuous, right? And it's like unbelievable.
36 hours continuous. I'm sorry if I may cut you. After the 36 hours, that week you might have some presentation. You might have a case
For
presentation,
which you have to
and they
work.
will, for a fact, they're gonna grill you, they're gonna screw you. There is no way that you're presenting. You have to go read also. So the next few days, and then you're finishing, and then maybe in the next 1 or 2 days, you might have another duty as well.
Exactly. So it's gruesome. At the same time, I feel what you said brings about a very important point, which should be the turning point of how we all teach and learn medicine, which is you mentioned about empathy. It's almost like a mechanical thing, right? Writing orders. As doctors, we just go write orders,
True.
and then the nurses take the brunt. Nobody talks about them, right? All night, and the patients and their attenders. So, very true. I am a huge fan of this concept called uh, human skills, which I think should be the foundation of medical practice. Because all of our patients come to us with ignorance, with fear, and with the whole idea of pain. Either they are in pain, or they believe that with an intervention that we are going to do, it's going to cause them more pain. So healing goes for a toss. Nobody who's coming to you is coming to you thinking that, you know what, I'm going to be healed after this pain. At this point, that's the time they actually live in present. So they're
True.
worried about
Absolutely.
it,
Yes.
right? And all of us as doctors, or most of us as doctors, don't even know that this is the psychology of the patient who is sitting in front of us.
Sure.
We are so, I think terms like healthcare should be changed. Terms like consultation should be changed. It's such an egocentric word, I think, that I am consulting you, like I'm your consultant. which puts you at a pedestal no more than anybody else. You become Lord Shiva and you become Lord Vishnu. You're there. And everybody else below you are below you, and you have to listen. I feel what we should move to, from saying, I am a surgeon, I am this, I think we should say, I am a human care expert.
That's so nice. I think, yeah.
No?
Yes.
So just imagine if I say that I'm a human care expert who deals with your oral health issues. So even when students join medicine, they would join with this mindset because that's the term that's catching, which is human care. So people who are thinking of that would join this particular profession. Unfortunately, if you go and ask people today, why do you want to become a cardiothoracic surgeon or neurosurgeon, they probably will end up saying that I like those surgeries.
Yeah.
I want to do something.
Yeah.
But
Which they're unaware of what is actually happening.
exactly, right? So imagine if we change that term to human care. Second, so we need human skills. To be providing human care, we need human skills. Second, I feel is we should remove this word consultation from a medical practice and simply say conversation. Imagine if every doctor will have a conversation with his patient. Even the patient term is so demotivating.
I
I,
know.
I don't know what else to, like, I've been cracking my head over this, but I'm sure if somebody else who's listening to this podcast, if they have a better word, I hate the term patient because it makes you feel sick, right?
Yes.
Everybody has a problem, whether it is here or anywhere in your body, it is. And like we said, dukkhalayam ashashvatam. So everybody is in misery, everybody is suffering, everybody has a problem. It is just that we make somebody named as patient. So can we change it from a consultation to a conversation? Then I think automatically the art of listening will come, the art of empathy will come, the
True.
art of hand holding your patient will come. Second, it will also change the dimension on the patient. What we as doctors are not understanding is the moment we are putting ourselves on pedestal like we are God, people like are going to temples and saying, God, I'm writing exam, you pass me, it's your problem to pass me. If I hit a negative roadblock in my life, it is your problem because of you. And that is why you face all of this. Same thing doctors are going through brunt. Like we are all saying that patients are nasty, patients are getting more and more questioning us. And we are feeling the heat of patient questions and warmth of their anger and irritativeness and all. That's because I think we are also a part of that reason. We should first look at it. This is like, like Michael Jackson says in one of his songs that man in the mirror. If you really want to make a change, make a difference, take a look at yourself, man in the mirror. So I feel if we all as doctors also introspect as to why are our patients feeling this? Did I give enough time? Sadly, 2 minutes is the average consulting time of a doctor in India for their patients. In 2 minutes, what can you understand of that? Because we are not this body, we are this emotion. Anything can heal if we truly will be able to spend that quality time with our patients, understanding who they are, what their fears are, and acknowledge those fears. Half the solution is gone. In any conflict, forget about a health issue, in any conflict, I think between the two grieved parties, if both acknowledge that, yes, I acknowledge the fact that you're in distress, and let's see how to solve it, it solves 90% of the
True.
problem, right? And so what you said, especially coming from a highly accomplished doctor like you, makes a lot of sense. And I hope that the younger generation picks this up. Maybe somebody from education in medicine picks this up. That look at it, right? You're being a doctor, you're not separated from a health problem or a health issue.
Nobody is.
Nobody
Nobody is
is,
spared.
isn't it? Nobody is spared. Very well said. So what are your reflections about life in general? Like, what is, uh, how do you think this has changed the way you think?
So, well, I think for me, um, for me, life before cancer and life after cancer, I'm still going through the journey. It's still not over yet. And
It will get over soon.
yes, it'll get over soon. And I think my whole perspective about life has changed. The way I look at, I mean, I've always been extremely emotional, sensitive. I have my own emotional uh, problems that I dealt with. I don't think that cancer at this point of time that I'm going through was also somewhere a deep inside a reason because of a lot of emotional suppression
Hmm.
or things that I was going through that I wasn't able to express. So I definitely know at this point of time, I mean, along with being treated with cancer, which I am being treated, I know that will be treated, and there will be a time where I will hit that normalcy. But I also do understand that there is some core problem that I'm actually going through. That is the problem that I actually need to heal within myself.
Hmm.
And right now, am I doing anything about it? No. But I still feel at this point of time for me to be handling the current situation itself is a very big thing for me because
Priority.
I every day seems to be so different. I mean, I cannot tell, and I'm so thankful. One thing I feel that in pain, I've realized I'm more grateful for things.
That sentence is like Kunti. She prayed to Lord Krishna telling that please keep giving me problems because I will then never forget you. Because we are always looking at the Lord only when we have problems. So Queen Kunti actually goes on to say this, that, oh Lord Krishna, please keep giving me problems so that I'll never forget you.
So, like I said, I think pain teaches you a lot. Pain is the biggest teacher in life. I think with no pain, you will never be able to. Yes, there is always joy, but I personally feel, at least I know there are some problems that I need to deal with, and I have to make time for it. I shall eventually do it because at this point, there's so much in my plate that
Priority.
I'm not able to do a lot of other things as well.
Hmm.
Yeah, I mean, even as this whole journey of my chemo is in the last 2 months has not been smooth. I mean, I've been having issues every now and then. Like, I finished my third cycle, and
How many
ju-
more to go?
two more to go. And I finished my third cycle until such time things went well. My nausea continued, and and I every cycle I had some new issues. In one cycle, I had extreme nose bleeding, and I've developed acute rhinitis. My nose just waters, just like that, and I cannot. My perception for smell is so amplified that unless the smell is very pleasant, I can't wear a perfume. I cannot be in a place where someone is wearing a perfume because it's too strong for me to take. I mean, the perception for taste is gone, but smell is enhanced. So I'm dealing with a lot of things at the same time, and then there is not a single day because for about good 7 to 10 days you have a lot of loose motions that you go through, and no matter what, and there's not much you can eat, and then in the night I realized that I cannot. It's been a while that I've slept for a continuous 6 to 8 hours at a stretch, max maybe 6 hours. In a few days in a month, not all the days, because depending that the severity of the symptoms it is. So I know I have to, like how life teaches you, how you start adjusting to it, and how you make peace with it is so important. I know I have to wake up every 1 hour in the night. I need to go to the washroom. So I tell myself no turning on lights because I realize when you turn on lights, I lose my sleep. So I do the whole thing without lights. I wash, come back, and I keep my things there and I sleep. So all these things that I realized humans are so capable of adapting to changes.
Hmm.
And the adaptation comes with a lot of acceptance. The same thing I can crib and be
Hmm.
unhappy about it, and the same thing I can still do it, not cribbing about it, because I'm still looking forward. Because in the morning, I want to wake up. I want to still take a shower, get ready, and get to work because that's the thing that is keeping me alive. Because I think routine is something, you are defined by your habits, and that habit defines what you are. And I think that keeps me alive, because it still makes me feel so normal going back, and my medicine is going back and seeing those patients and seeing those babies and going and saying hello to my friends and colleagues. It makes me feel normal. Maybe if I wasn't doing, then maybe I would have felt, oh, I'm actually going through a major problem that I'm not able to work. So I think uh, working through during this process, I mean, has made me feel very normal about it, and only make me understand that this is. I only think that anytime I'm hit with a problem, that it is a complication. So for me, I'm my own textbook. Like, this is a complication that you're going through. It needs to be dealt this way. So I don't allow it to affect me mentally.
I wanted to know from you, because you did speak about so many, let's say, complications, and also some of the things that you go through. Like you spoke about nausea, you spoke about loose motions, and all that. What are the other related complications, or things that you go through as a part of this chemotherapy?
So, the kind of cancer that I have a triple positive cancer, which is an estrogen, progesterone, and a HER2 positive. So that means it's completely hormone dependent. So when I actually went for my consultation to a medical oncologist, he did tell me that, you might have to attain a surgical menopause, because apart from chemo, they're also giving me immunotherapy, something estrogen antagonist, to stop my estrogen, because mine is estrogen dependent cancer. So I was like, okay, I didn't realize, okay, maybe I will not get my periods, I'll have some menopause. I'm 42. But I think after my first cycle, I kind of didn't feel it. I think around my second cycle, I just had some spotting, and I was like, okay, I will not get my periods. I was prepared. After my second cycle, things got really worse. Apart from all the symptoms that I was going through, which were a part of chemotherapy, which most people would go through, this menopause hit me so hard, which I didn't know, which I wasn't prepared, because most things I wasn't prepared for. And I started feeling like, when I was trying to sleep in the night, I felt like my head was put on a heating pan, and I could not sleep. And I could feel I would wake up with uh, slightly tachycardia was always there with the drug that I've taken, and my heart rate was always 110. My baseline heart rate was around 110. I would have this night, especially the upper respiratory night sweats and all of it, and I could hardly sleep. Now, some days I suffered with diarrhea. Now, this whole menopause and the hot flushes, being a gynecol, I haven't practiced much gynec, but yeah, I always knew menopause would cause, and somebody would say, I would say, don't worry, all of it, unless, like I said, unless you don't know it, you will not understand it. But it is for real very difficult. So then I realized I would wake up in the night, put one wet towel on my head, and then try to sleep and, do a lot of things, but nothing kind of work. I mean, I almost used to feel in the night that maybe steam is coming out of my head. That was the intensity. Maybe because I was also, imagine if I'm in estrogen positive, my estrogen levels would have been so much more, and to not have it all of a sudden, it's been very difficult. That was something. And they said, yeah, oh, with menopause, you'll also have mood swings. Mood had no role in my life, because I had to deal with so many other things. So mood swings were never a part of it. Yes, that was something that I was actually dealing with. That was the time when I realized, when things started getting hard. But I wouldn't cry, I wouldn't feel bad. I've just, like I said, I've learned to deal. I've learned to accept, not deal. I've learned to accept my physical problems. And that's when I told myself, when, like I said, when this thrombosis happened, and then hot flushes didn't come into my life, because the thrombosis pain was greater. That was the time when I realized, somewhere, because I was a doctor and I was very clear that, you know what, when I'm doing this, that this is expected. I was very textbook. Okay, this is something which I know I'm gonna have it. These are not the things that, anything that came out of the box that I had knowledge. came like a jolt to me. So then I told myself at that point of time to give one leverage of an extra box, which is 50%, that any time any complication can happen, it could be life threatening as well. Be prepared for it. Don't think that these are the things only you're going to deal with this. You also have a space for things of unknown and anything that can happen. So all these things that you're dealing with, your thrombosis, your menopause, are all falling into it. So it's okay. So that's the way I told myself. And I think, yes, that's something that really very difficult for me to take it. And then I did talk to my doctor. They said, let's go for a surgical menopause. The last time I said, no, hot flushes are difficult. I will keep doing breast scans and I will keep doing scans at good intervals. Let's save my ovaries. So for now, he said, let's see how it's going to respond. Fortunately, after my second scan, the doctor did come for my third chemo. When he came, he every time checks my breast and to look for the lump, and then he couldn't, so I had to pick it up with my hand, with my two fingers. I said, this is the portion. So I went for a scan, and my friend did say that I'm responding very, very well, and 70% of the tumor size has come down. So the only way he could make out that there is still a small uh, tumor is by the marker that has been put. So he says, the way I went was I looked at the marker, I was trying to delineate a little mass which is little different from the breast tissue, because your mass has almost become so soft and close to the breast tissue. Maybe I haven't gotten any scan done yet. I thought, let me finish all of it. So it did respond well.
So, how important is work for women?
I think for any human, I mean, I think for anybody, I mean, for women it is, I mean, I do not want to separate it. I would just say for anybody, I feel that, there should be something that they look up to in their life, that they should also be passionate about. See, even if you're not dedicated, sometimes it's fine. I mean, you can just work a few hours. Dedication doesn't mean that you need to be working for 6 hours, 10 hours, hard working. But passion is so important. When you have that passion, you're happy about it. So I feel work is very important, so that, and where you find your passion, I think that keeps you alive. That has been my fuel. I mean, I feel so normal today only because I've been working. If I wasn't working, then imagine I wouldn't have been taking shower in the morning like the way I would, like how I feel. Yes, but I had my own challenges even going to work, because imagine for me, like I said, my hair was my crowning glory. I remember every dress that I wore, how I looked, not that I styled, like, for a change for me to wake up in the morning and you are actually feeling nauseating. You are every time, every 2 hours, you're going to the bathroom because you are having diarrhea and you're looking at yourself. Imagine at how many levels it breaks a human. I used to tell this to myself. You're not looking yourself anymore. When I look at myself, if you would ask me, were you unhappy? Were you very sad about it? I would not say that I was not very sad, that I wanted to sit and cry, because I never had the energy for that. But if you would ask me, were you happy? No. Maybe things would have been easier for me if I looked normal when I looked at myself. But
Right.
imagine the way it breaks you down. The whole point of cancer is so difficult because you cannot eat what you like. Somewhere, a lot of people, when they're depressed, they say trauma eating, because we are always associated, because when you eat something, it sometimes gives you that gratification, you're feeling good about it. So it doesn't, so there is nothing to feel good about when you have cancer. Like, even if you're feeling depressed, you can't eat because it doesn't taste good. So I'm like, it smells so good when you put in your mouth. I would eat something and it would taste something so different from what I actually know. So I had to break myself at different levels to tell myself and push myself, I don't look the way I used to look. I don't feel the way I used to feel. I can't eat the way I used to eat. I can't go for a walk the way I used to because I used to feel tired. I can't sleep like the way I used to. There's so many changes, but only one thing that I was still doing was I was still able to go to work. So I clinged on to that. I
Mm.
told myself I needed something, that was my clinging thing. So I clinged on to it. So I got myself a wig, paid a lot of money, went to 4 5 people, finally approved. But when I wore myself and I looked myself in mirror, I told myself it didn't look a part of me. It looked an extension of something else. And I said I could not accept myself looking the way I looked when I looked in a mirror. I told myself, then how am I able to present me with something which is not a part of me? I will not be able to do it. Then I told myself, Shai, you need to accept yourself how you feel. This is not you. I said, no, that's it. I've worn it one day to the hospital. Uh, for a couple of days, I did wear, and then I got it, I wore it. All my girls said, oh, it's nice. Obviously, they don't want me to hurt. But the second day, when I went, I wasn't happy. I removed it in the car. When I sat in the car, I told myself, I'm not going to take this extra burden. I
Nice.
don't need this. And you won't believe how liberated I felt. How liberated I felt to accept the way I am, to accept myself. Forget about others.
I think that's the way to live each day, isn't it? To be happy in this bag of skin the way you are.
Yeah.
And if you're able to live that, there's nothing like it.
So I will still say, when you say, are you happy? I was so much more happier. I still love my hair. But I know it's a transient phase. I'm going to get that. But I'm not unhappy. So for me, that's still a milestone. I thought what would be depressing is normal for me. So for me, that's good enough. I don't need to be happy about everything that's happening. So I also happen to have a friend, I made a friend, one of my friend told me that his fellow was diagnosed with exactly the same cancer. Why don't you talk to her? She's just going through the treatment. She's Dr. Zenita. She's in Mumbai. And then, I mean, she's been so kind enough. And I think it's more easier to talk to people what they're going through. And then she really spoke to me. She said, I did the wig here, you should do this. And she would say, your nails would turn. And we've become friends and we were talking. And she's like, there were times when you're frustrated. When I could talk to her, I do understand that she could understand me better than anybody. Because unless you're going through that, it is very difficult for somebody to, like people would say, she would tell me, like, ma'am, like people would say things like, what, wow, you're so lucky you have this. So I'm like, I want to slap them one. Do you even know why are you saying it's lucky? Because I can be treated. So I so felt her, because I think she didn't finish her family. She wasn't working. And then she said, ma'am, you're actually taking it so well. That's when I've realized, yes, maybe I'm really taking it well, because I do understand her frustration. She was having so many patches on her skin, losing your eyebrows, you losing your eyelashes. These are very important for girl. People do everything and anything only to look good. But then I realized at some point, no, if you accept yourself, I think this has also been me. I've always done everything only for myself. It never bothered to me what others are thinking about me. It only bothered to me how I was looking. So I think that became very easy for me. But I do understand when I did talk to her, and then I said, thank you for your time, like the kind of time that you're giving me, and you're helping me with so many things. Then she said, ma'am, I did reach to a lot of cancer survivors. Trust me, I didn't know them. And I also asked them the same question. So they said, you will find a lot of people on your way who would find you and ask you like this. And I think then you will understand what we're saying. So now I know it. Like when you're calling me, and I know you must be feeling, you're filled with gratitude. People are asking you a lot of, I mean, helping you so much, and you will be filled with gratitude. But this is how it is. So I felt the whole thing of cancer is, it's like a battle of a grief and a gratitude. You're between it for a lot of people, because there are a lot of things that can pull you down. Lot of
Yeah.
things.
Oh, yeah, absolutely. So I do understand you still have few more cycles of chemo left. Then I'm assuming you have to go through a surgery,
And then a
a
radiation.
radiation. What is your greatest fear? Is it pain? Is it transformation in your physical look? Or is it the fear of death?
None of them. I don't fear any of those you've said, because I very clearly know that the thing that I'm going through doesn't cause me death.
Hmm.
One thing. Second is fear of look. Yeah, I mean, I wouldn't say fear of how I'm gonna look, because I very clearly know that, I'm gonna grow back my hair, and then I'm feeling quite confident in the way I am. So the way I'm looking is not something, because I know it's also a transient phase. Pain, I'm not fearful about it, because I think I've always been strong, and this whole cancer has just made me the strongest that I could ever be. And I know pain has can be treated, and it will take its own time, it will take its own course. Like I said, post my third cycle, when I was supposed to go for my third cycle, no, my fourth cycle, and then I called up and I called the doctors and I told, actually I'm having a pain in the neck, that I was supposed to go for my chemo. Then they said, okay, let's just get one scan done and see, because they put a central catheter for me, central line. And then the scan and the doctors again, same. Everyone are looking. So I'm like trying to read their faces. Then I've become the patient for the first time. I'm like, what's happening? So then the head of the department came, because when it's a doctor, you understand, right? There's so many more people coming, this VIP treatment, this happens. Okay, syndrome. And then I was like, I'm looking at him, and then he says, Shailaja, I think, doctor, there is a thrombus. It's very cool. I was like looking and smiling at him, and I was like, oh, then I said, how often do you see this? This is the first time we are seeing there. That is something which I didn't like. I said, what do you mean this is the first time you're seeing? I'm actually an Aster. I know onco is like so predominant over there. That's one of the blooming branch there. And they're seeing so many patients, and you can't be telling me this is the first time you see. I said, okay. Then spoke to the doctor. Then we all spoke over the phones. They said, okay, they were all talking. And next day they said, come now. They're all fearful. It could be because of the port, because, the radiologist has put, he's taken longer. This is again because I was going, Dr. Anil called the IRI president to call them up and saying, my girl is coming. So he's like, ma'am, you know the IRI president? I said, I don't know who you're talking about. So all these things my friends have done for me, but yeah. And then yes, I landed up with a thrombus, and they were all discussing. Now, no, I said, the pain is unbearable now. I can't move my neck. So they said, we can postpone your chemo. I said, that's fine. Now they said, we cannot put the chemo again back. We will think about it. I said, are we retaining the chemo? Is the port? They said, no, we cannot. I said, fine. Then I said, are you removing the port? They said, no, we'll wait for 3 days. I said, fine. And then they put me on heparin. They said, fine. Then I went to saw my friend and this Dr. Prem. And then he lost his father 6 months back. It's like, no, you go get admitted. I've seen so many, because he's a radiologist. He's seen so many patients with some embolism, anything you needed, it'll be done. All that. Okay, I know he's coming from a place of being a friend and family. So then I had another friend, and Dr. Vivekananda, vascular surgeon. I called him. I said, this is my report. This is what my doctor has said. This is what I've been put on. And now my friend is saying I need to get admitted. Do you think I should get admitted? He said, no, not necessary. Don't worry about it. You go home. I said, fine. I reached home. I called him up. I said, I cannot take this pain. He said, okay. And he put me, I'm going to put you on this tryptamine. You might feel slightly sedated. Now, Friday, Saturday, I'm me being me. I've taken off thinking I'm going to go for a chemo. Now, Friday got wasted with all of this. Now, I called up the hospital. I said, I'm coming on Saturday, because my chemo is not there. With that, I went, I did a couple of scans, came back, I took the tablet. The whole Sunday, I slept for 20 hours. I think that was the highest pain I've experienced in my life. I was on 12 grams of paracetamol.
Wow.
12 grams of paracetamol. And the pain was just 30% lesser with
Wow.
12 grams. And I was sedated. And then Monday, I thought, me being me, Monday, I thought I'll go work and then go. I called up my doctor. I said, okay, 2 o'clock, I'll come. He says, no, 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 the surgeon wants to see you. come in the morning. So I feel very bad to call up to the hospital and say, I'm not coming today. I think in my entire 14 years, I've only done it like 3, 4 times, saying that I cannot come. And I called up my center head. I said, I thought this procedure would be in the evening, but they want me to come in the evening. Don't mind, can you please cancel mine? They have been extremely understanding. They said, absolutely fine. I went, the vascular surgeon came, very gentle. He said, you want me to do it in general? We will do. I said, no, let's do it in local, all of it. And then I could feel the difference between a radiologist suturing and a surgeon suturing. He just sutured like a petal, a flower petal,
Hmm.
beautiful. And then I got out and I saw and I got all my reports. So I asked my sister, give my reports. Then this doctor came and I said, sir, my HB is 9. You want me to take something because before I take my chemo, he says, rest all are fine. Don't worry about it. Next week come. We'll do peripheral lines. That day, when I got diagnosed with thrombosis, like I said, I did feel bad. I did feel bad not because of the pain. I did feel bad. I have been so strong. Couldn't have been more stronger than what I can. Everything that is coming my way, which has been not easy, which has been very difficult for me, I'm still smiling and I'm telling, I'm going to do this. Why me again? I'm losing my strength to be more positive because this was just so unexpected. I felt bad. I have this very dear friend. I call him. He's great. He's been doing meditation. And I said, he always tells me the same thing. Doc, you can look at a problem as a problem, or you can look at it as a probability. It's up to you. Now that you have, what will you do with it? I said, yeah, but I just had to call you up and tell you that this is how I'm feeling. Finished, we spoke, exchanged. I told myself, yes, I'm going to experience this pain for another 3 days. You need to accept that they're going to remove your chemo port. Don't feel bad that you went through the procedure of pain of chemo port, and which is so easy. Now it is not suiting your body. They have to remove it. And you have 3 more cycles. You cannot re-put it on the other side. Let us do it. So just think you are in this time where there is no chemo port.
Hmm.
Then they would have used peripheral lines, right?
Hmm.
So this is what you're given with. It is so easy for you as a doctor, not think and just say it to patients. No, that's not possible. You have to go through it. You not even know because it's happening to you. You're giving yourself so much importance. That's why you're feeling bad about it. You're gonna deal this way. I told that myself that evening. I did feel very miserable because I felt I might not be able to take it any more positive because I have been extremely positive. I told myself, this is not gonna weigh me down. This problem is not going to weigh me down. I'm gonna treat this problem as a problem. I'm not gonna let my mental strength is gonna help me deal with this problem. You're not gonna sit and cry. I was also dealing with another problem in my interpersonal relationship, which was actually causing my trauma. That is the day I felt, I also am not going to deal with that. If you're going to deal with this, I told an end to that as well. That gave me so much strength. You cannot imagine the pain that I went through at that point of time.
Hmm.
And when I got out of it, when the day, you will not believe that day when I had that pain, when I slept, and when I ended my other personal emotional problem, I woke up with lesser pain. I went, removed my port. I came back. Next week, I did my cases, all of it. Next week, I've taken holiday again. I went for my chemo, and my driver wasn't there. And he went for his daughter's birthday. So I told myself, okay, let me drive. I drove. They tried ports. Usually I go around 10ish. By evening 5:36, I finish my chemo cycle. And they tried one, didn't happen, tried one more. I've also realized my pain threshold has also come down. than what it used to be before, because I'm not physically so
Hmm.
strong, right? So even small pricks are causing greater pains. I've understood that. And then the third prick, I told sister, please, I it's getting very difficult. Some of she managed. So till until such time with chemo, my hands, legs were mobile, everything. I was reading books, operating. Now you move little because the veins are small. I'm trying to get. Then I told myself, don't worry, it's fine. And the whole process took to 11. And mom was home. I was there. I had a friend who had come in the afternoon for lunch. I was reading a book. And I think the chemo went on till 11 because it was difficult. And I actually had pain in
Hmm.
between. They had to flush, like real pain when they were
Wow.
flushing. I still have an extravasation of drug,
Hmm.
and which is like painful even now. Um, at 11, I finished. I thought maybe if I cannot drive back, I'll call some friend to drive or take a cab. I felt nice. I don't know. I had one bag and I had just two bags with me. I was walking. The security asked me, Madam, aap akele ho kya? I said, haan. And I was fine. I wouldn't take a risk or I wouldn't take a chance. I was walking through. I had two bags. A doctor helped me open a door when I was exiting out. You will not feel, doctor, how I felt at that point of time. I felt so powerful. I felt so good walking out of that hospital. I felt that was the time that somebody actually came up to me and asked me, can you do a small reel for us? I felt so good because I felt mind over matter. Like when you can actually feel and go through and navigate and not give the problem so
So much
much
importance.
importance, the problem becomes so much smaller. It
Yeah.
is us, it is me. I mean, I don't know, I don't want to talk about it. It is me who made the problem bigger by thinking about it and giving it more power
Hmm.
to it. When I felt and made the problem smaller and I made myself bigger, the problem felt so smaller. I drove myself and I went home. I cannot tell you what I felt that day was one of the best days that I felt. After people said after your fourth cycle you'll be very tired, after your fifth cycle you'll be very tired. Yes, my fourth cycle they changed my drugs because my body wasn't taking, because I did get admitted one day before New Year's because I
Hmm.
had some 20 loose motions and all of it. And so they had to change my drugs. I'm dealing with the new one. I felt after 2, 3 days the same thing. And then somebody was taking a punching bag and they were hitting me. That then the doctor said, this is what your drug does. My doctor smiles and says, don't worry, for everything he says, take paracetamol. I'm like, okay, I'm not calling you. I know it. So usually don't call him. But yeah, I do understand. So I know it. Like I said, I've learned how to handle my physical problem. But when you do not give so much importance to the problem and witness the problem, and I think when you become mentally more strong, then you become actually mentally more strong to able to deal with it, and it's never a problem.
Great.
And I do understand life is uncertain, surrender to it. Because I'm able to actually, you will not believe how funny it is that because of the problem that I'm going through cancer, and I've learned how to separate my physical problem, emotional problem, mental problem, I've just applied the same thing in my personal life, what I was going through. And I think life just changed.
Nice. As a doctor, pre-cancer Dr. Shailaja seeing a patient versus post-cancer Dr. Shailaja seeing a patient, what is the difference?
That's a huge leap. I have to tell you, I always have a problem. I mean, at this point of time, I think I like to be vocal about it. I always competed with myself. I do ultrasound. I want to do, I really, for me, like when I'm taking good images, I'm seeing a patient, and every patient is different. Like, if the patient is slightly obese, you do not get such good images. I would take it so personal. You won't believe that, I'm not getting images, I'm not happy. For me, it is about how I'm delivering the image, how fast I'm doing it. For me, it was like a video game. That somehow gave me gratification, that filled my ego that I'm doing very well. I don't know what term to give. So I thought I was very not very empathetic. Like, I would find it very stupid. Only now I'm able to understand. Like, people operate from fear, and fear actually causes, does not allow you to think normal.
Mm.
Your normal sense just goes away. That common sense that you have goes away, because that's what fear brings into you. Like, I would be telling patients, like, you know what, I would finish a scan, I would make them hear the heartbeat, and then show them their baby, and tell them, congratulations, the scan is done, baby is looking all normal. And then the patients are actually looking at me and asking, is the baby good? So I'm like, so there were times I actually was rude enough, and I actually did say, I should be stupid to say congratulations if everything is normal. Yeah, but I think now when I go back and see, when I see, I can read their fear, I
Mm.
can read their pain. I think I needed this pain to understand things better. I was good at my work, but I could have been better by understanding people, by being more empathetic. I wouldn't say I lacked empathy, but I was more mechanical.
Where's your ego now? Like, we are all, uh, in a way, engulfed in this, whether we are aware or not aware. But as a human being, where is your ego now?
Ego, um, I really don't know where was my ego then and where is my ego now. Actually speaking, but I really don't know how to answer you this question, because I'm not able to place myself. I don't think I was ever egoistic. I was. I'm not saying I wasn't egoistic, or maybe I'm not able to put it across. It was never about ego. It was just that I was.
Would you get offended now if somebody made any comment which you feel is unreasonable?
Absolutely no. You would not believe, like, there was a time when I wanted to go out at some point during this phase. I mean, I hate ice creams, but now I realized only ice creams are the only thing that, that I can eat, and that my doctor said, no, eat ice creams, it's fine. So I would go, initially, I thought, um, it was very difficult to go without the head mask. And I'm also dealing with another problem that I would want to address, and most people might go through it later. I felt when I was going, I accept myself so much. Once you accept it, that acceptance from others
Doesn't matter.
does not matter. I mean, how would I care that somebody that I'm going on road is actually judging me? For me, if somebody is judging and looking at me, I would actually look at them and pity them rather than going and fight that,
Mm.
how inhuman, insensitive can you be? Actually, you're trying to judge somebody who doesn't have hair, or who you're looking at somebody. Okay, it's common for people to look at you. I do understand when I'm walking into the hospital, a lot of patients look at me. I mean, yeah, because I'm looking different, or whatever it is. So I'm like, I'm okay. I do understand. Like, maybe I would do the same thing, but that is not affecting me at all.
Nice. So, one other point that I think I'd like to understand from you is, have people around you changed, good or bad?
I would say both. I mean, very few, one or two, I would say bad, but a lot of friends that I've not been talking, because you've gotten busy in your own life, they've gotten busy in their lives, and maybe you had some misunderstandings, like maybe you were egoistic, oh, she's not talking. Yes, if you would to ask me at this point, I'm able to see a lot of good in a lot of people at this point of time. I've become less judgmental than what I was before. I'm very grateful for everything that comes to me, unlike before. And like I said, Dr. Anil, we were very close, and I used to look up to Sir when I used to join. We used to go for walks, we used to talk. I think, I don't know what happened. Something just happened. I changed, and some small little things here and there. We kind of didn't talk, and we kind of moved apart so much, but we were so fond of each other and all of it. And at one point I really hated. I didn't want to. Like it, I think I don't know about it. I'm sure he did the same. We did not want to bump into each other at all. So I have noticed so many times that I would go and then his car would come because his girls would call, oh, she left, you can come. So it was that clear and it was evident. I made peace with it. Initially, I was like, why the hell should I work here? I don't need to work here. I'm only coming here because my friends were there. But I somehow liked the place, and I always told, you need to be true to your work. You don't have to bring in your personal. He's not brought in it. But I felt the moment he got to know about it, he did not take 2 minutes to call me. He was
Mm.
in London. He called me. He said, Shailaja. He called me. I didn't take the call. He texted me, can you call me back immediately? Then I realized that, sometimes you are lost in your own misunderstandings and in your own ego, that you might take very small things so personal and make it so big and not understand the other person at all, and you might let go of the whole relationship. And
Mm.
then I realized he could let go of, and then he said, you are strong, you are this, you are that, we will do this, I'm gonna come. Dr. Beliappa, the the medical, the radiotherapy, what is it called?
Radiologist.
Not radiologist, medical
Radiation oncologist.
radiation oncologist, who's the head of the department of Asteris, his childhood friend. He spoke, he got things done. He said, Shailaja, I'm going to get why they will not accept Google Pay. Take cash. He was there for me at every single moment. And every time he would hang up, he really meant it. He said, call me anytime. Anytime you want to talk to me at any point, call me. I lost my brother with cancer. I lost my brother in law with cancer. I took them to the US. I did this. I did. And he was so genuine about it.
Mm.
I only had gratitude. I only said, how I wish I could only see good at one point of time. And I told myself, sometimes I do really think that, I really needed this cancer to understand life so much better. I know it's not easy, but yes, I did get rid of the things that were actually troubling me, that was actually controlling me, all of it. I also gotten, like, there were a few friends that I've lost in touch, and one day I was watching TV. My mom was surprised and she looked at me. I said, who? She didn't even know. And those girls just walked in. They said, we just got to know and we couldn't think for a second. And she said, and they were just there for me. So, lot of people that I didn't think were close to me, I mean, who were just my friends,
Mm.
have actually been there for me. And I realized that, you're so wrong. Maybe that's where, like you said, now maybe I'm able to answer your question, where was your ego? Yes, somewhere I was ego. I was also thought I'm right. Now I understand that, life is more than what you actually understand. And I'm only, like I said, if I didn't have this, I wouldn't have understood life this way.
Yeah, that's so true. I think many ways to realize, the sooner we do, the better it is. I'm sure, and I wish and hope that people who are listening to you would understand the true meaning of life and the true meaning of relationships, and how petty at some times we can get to kind of lose all of this. Because when we leave this world, I don't know what we are carrying from here, right? And we've had a wonderful experience similar to this in our clinic. We have this habit of writing some meaningful quotes, predominantly from the scriptures like the Bhagavatam, Bhagavad Gita, and stuff like that. We personalize and write a quote each day for each patient of ours. There was a patient who walked in, and he, mm, availed some treatment from us, and he came back after a week just to tell me this, that some quote, I can't remember what it was. It was about life, that it's very short, and things like that, about relationships. He said for 21 years he hadn't spoken to an aunt of his. And after reading that quote, sitting in our clinic, he picked up his phone and called her. And he said that 4 days later she passed away. He said he just came to thank me, saying that it unbelievably transformed me. I would have lived this entire life with guilt for a stupid reason that we stopped talking, and it was 21 years. He said, and all it took was that 1 minute of realization after reading it. So I think we all must live a more meaningful life. Like, that's what I'm gathering, and it's so helpful. And I can't thank you enough, because what you're sharing is the reality of life. And I'm ever going to be grateful to you for who you are as a person, because like you said, nobody can even come closer to understanding what you truly are going through.
Nobody can. And not
Yeah,
just with me, but with every cancer patient, like, because
exactly.
everybody's journey is difficult. It depends.
Exactly.
I mean, when I see it, if sometimes the days that I go through, I'm like, okay, I have the strength, I have the age, I have so many things in my power to
Yeah.
deal with this. There's so many people who cannot be dealing with what I'm going through. Imagine, it is so easy for me to call you because I remember you said the same thing to me. Call me anytime, I'm there for you.
Yeah.
I mean, no, I mean, it's not like, I just felt my perception of what closeness has completely changed.
Yeah.
There were so many people like this who I thought were close, and the person that I thought was close and I changed the whole world wasn't there for me. And it's such a great closure for you, because you also deal with a lot of things at the same time. It's absolutely fine. I know. I mean, I just tell myself, how strong have you become just to deal with an emotional break is so difficult for one person at that time, for you to
Yeah.
deal with physical problem, your emotional problem, you to deal with so many things at the same time. But like I said, the whole perspective of the cancer gave me a strength and gave me an understanding to understand, to not mix things, and to see problem as different, and to see it and to witness it and to solve it,
Mm.
which I never had it before. I would only overthink and overthink and make it so much more bigger. It would be this much, and I would make it like the whole world, the problem as big as the world and universe, and then I'm like, okay, I cannot solve it.
One last question I have for you, which is, how do you want to live going forward? What would Dr. Shailaja be as a person going forward?
Well, I have a couple of things that I told myself. One is, first, let myself get treated with it. I've realized one more thing which I've cut down over a period of time. The time that I'm working towards uh, work and giving my time for that, I've realized I should start my own center, and I always wanted to start a wellness center
We
for
spoke about it. That
yes,
was our
wellness center
conversation.
for
Yeah.
women, and I had a lot of ideas about it. But you're so occupied with so many other things because you're not constantly uh, uh, giving that time, because you don't have time for what is important. And I want to do that. And I also want to work on myself. Right now, I don't have the energy nor the time. Though I have the time, I don't have the energy to do anything in terms of physically to get fitter. I realize health is the biggest wealth that you have. Health is the only wealth that one should have. So I really would want to concentrate and to give a good dedicated amount of time to become more healthier, and then work on my wellness center, which I've always dreamt of, and give it that time, so that 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 is one thing that I want to. And one more thing, because I think, because of the time that you have at this point of time, because when something hits you, you start thinking, no, I used to waste so much time doing unnecessary things, going out partying, going out doing clubbing. I do enjoy music. I'm not saying I don't. All of these things, doing unnecessary things. Now there are days I do feel in the morning, like when I wake up and then I'm just taking my phone, randomly watching stuff, and then sitting and watching TV with my mom. I'm like, I actually wish I could have done things like this. I do understand the time is very precious, that, I can be more productive doing things that can actually help me doing it. I never even thought about it. So the very fact that the thought has hit me, I hope that, I will be able to live a more productive life. And then I really, really want to travel. So I'm very clear, like, I want to do something in my life, earn enough so that I could just travel. and the world and come. That's all I want to
I
do.
know that you're going to the Mahakumbh as well.
Yes, I am. Ask me after seeing the last three videos. Everybody are like, "Are you serious? You want to go?" Yeah, I think I've booked all of it, and let's see. I mean, I want to go and experience Kumbh and come.
Something that you will leave as an advice, suggestion, or an experience for everybody who is listening to us or watching this particular entity, what would you want to convey?
I still don't think I've mastered enough to give a great advice to anybody yet. But with the little experience that I've gone through in the last 3 months, and that has been my great pain, has been my greatest teacher. And I really feel that mind over matter. Anytime when you're stuck with any problem, life is uncertain. Accept uncertainty, surrender to the fact that this is going to be there for some time and you will be out of it, and to not uh, give any problem so much importance. Yes, if it's a physical pain, I mean, because I can only tell with what I'm actually
Sure.
doing through, what I'm going through, and what I'm following. I mean, and not overthink and find ways and means and tools. It could be anything for anybody. I mean, it could be meditation for somebody, it could be picking up a hobby, but somehow you need to find that uh, space in your head to deal with any physical problem, especially when you're going through cancer.
Mm.
To not let it affect you, because every day is going to be so hard on different levels for everybody, and especially because I'm going through it, and if it could help even one person, I mean, no matter what stage it is, no matter what it is, it's easier for me to tell because I'm in a place where I know I have a completely curable disease. So maybe at this point, for me, I'm more stronger and I'm able to say maybe there are people who are also dealing with a cancer that they know they have a limited survival time. But even if you know about it, there is nothing you can do about it. It's more difficult for somebody to go through it. But to not allow your mind to completely
Take
engulf into
over.
your problem.
Mm.
Somehow you need to understand and accept problems are inevitable, and you should not be eaten by the problem. You should eat the problem. That's all it
Nice.
is.
Lovely. Was very, very lovely catching up with you.
Thank you
Thank
so
you
much.
so much. I should thank you because it's very insightful. It's very important personally to me, and I'm sure to everybody who listens to us, to keep beating ourselves with this fact that life is much more than what we are imagining it to be, and constantly coming back from all the deviations that we have in our mind and our actions and maybe words, to the fact that uh, life's only meaning probably is to be good. And the fact that we are not truly in control with what the future is going to be for any one of us. So accepting what comes as it is,
And
but
accepting your mistakes as well. I've done
right,
like so many mistakes.
yeah,
There was a lot of time I was very guilty. This is one thing. I was very guilty. I was very angry. I think at this point of time, I did accept that. I also completely, genuinely accepted without guilt that, okay, everyone can take wrong decisions. Your emotional uh, 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 somewhere instability has made you take some wrong decisions, and accept your decision. So when I have accepted my problem, that yeah, you have been, I always thought somebody else was the problem for my problem, but I've realized that I am the problem to let that happen to me. It is not the other person. because you let the other person to be. If how can the other person get the power? Because you give them the power. When you take that power back and when you accept it, yes, you have been constantly doing and allowing it to happen, because there is some lacunae inside you that you need to correct yourself. So I've also done a lot of things in my life in a couple of years which I've accepted myself, to be in this place to understand and to accept myself and to forgive myself.
That's very important. I think mistakes do happen. It's foolish to repeat them, but I think that is where introspection is very, very essential. Thank you so much, Dr. Shailaja Garu, for sparing your time, driving all the way, and coming here. It's unimaginable for me, because this probably is one of the most valuable conversations I've ever had in my life.
Thank you so
You know,
much. You're saying
it's
such great words.
no,
Actually,
it
I have no words to
no,
describe.
truly, because I think we can learn science, we can keep reading journals, we can keep doing a lot of research ourselves and doing stuff. But this is like real stuff that is coming out from somebody, and that's such an honest thing for all of us to learn. And in this life, I can't get over the gratitude that I'll ever have for you to share
Thank you
what you have
so
shared.
much.
And I'm
Thank you
sure
so much.
hundreds and thousands and millions of people, I'm sure, will benefit from this, what you have done. And was a great pleasure. Thank you so much.
Thank you.
We have a small, Subodh, let it be on. We have a small token of appreciation for you, and let's do that. It was amazing, because I feel all of us at the end of the day are so much so tagged to our degrees, tagged to our profession, tagged to the wealth we have, tagged to,
Our material possessions we
yeah,
have and how we
even
look.
beauty, right?
Absolutely, ask me. That is completely broken.
Right? And none of it we actually own or are creators of.
Yeah.
This beauty is actually given to us by somebody higher up there, God, nature, whatever you may want to call it. And we take so much pride in each one of those elements and live our entire life and forget to focus within ourselves to find out who truly we are. No, that was the outcome for me and the realization for me that I gathered from the conversation that I've had. Ever grateful for it. Thank you so much. Please accept this from us.
Thank you.
And that's
Thank
Ganesha
you.
for you.
Thank you.
He is Vigna Vinayaka. So all obstacles and power to you will get you out of all
You, I
obstacles.
mean, you won't believe, like, small little things also make you feel filled with gratitude at this point of time. I've had this friend of mine who is like the chief executive counselor of Ladakh,
Hmm.
and he's come because they're Buddhists, and he's visited a couple of monasteries. And when he was here, he visited my house with his whole family. Trust me, he got to know about it. It's that simple thought of somebody. Actually, I've started seeing good. Like, there's so much goodness in people than beyond which I actually could think. I feel I was like a very good person, but I feel the world is filled with a lot of good
Oh
people.
yeah, I
It
completely
is.
agree with you.
He actually got me a statue of Tara Devi,
Hmm.
and his wife has told me, because they were there with me, he spent a couple of hours, and his wife has told, Shailaja, ever since he got to know you were diagnosed with cancer, every monastery would go, especially he would put some money, get a puja done on your name, and he's consecrated this Tara Devi along with one more Murthy that we've taken for our house in every place. And the reason he chose Tara Devi, because that is for longevity of life. And he gave it to me in my hands. He said, put it to your in mandir, don't keep it anywhere. And please do puja. And he got me a wall painting of Tara Devi. He asked me to hang it. So there's a wall painting of Tara Devi right behind. He got me incense sticks. He's got me lot of things praying for me. I mean, imagine small little things, how thoughtful people are.
Oh, yeah, absolutely. I completely agree with you that the world is filled with very good people. It's our mind that is constantly diverting us from this thought that there are good people, because we are driven by our own selfishness, insecurities, ego, and the sense of grabbing or achieving
Yes.
something beyond ourselves. And that probably gives us the feeling that everybody is nasty. But great, thank you so much again, and may God
Thank you.
bless you.
Thank you. Thank you.
Take care. Namaste.